Good afternoon, and thanks for watching. My name is Dr. Julie Mariotti, and I'm a family physician at McLaren Northern Michigan, Gaylord Family Medicine, and I'll be doing a brief discussion on HPV. HPV is known as human papillomavirus, and it has been well known for years as a cause of warts on the skin, whether it's flat warts on your fingers, plantar warts on your feet, or also warts of the skin in the genital area. But we now know it as the most common sexually transmitted infection in the United States today. HPV infects a total of 14 million new people every year, and the number for genital warts is even higher. Why do we care about HPV? Why don't we consider it just a routine STD? You go to the doctor, you get a shot, you get pills for it, and you're cured. And the reason is that we now know that HPV causes cancer, and not pretty cancers. They can cause cancers of the genitals, of the cervix, of the anus, of the mouth and throat. And it can be very hard to detect in those instances. How do you prevent from getting infected with HPV? The most common sense method would be to have protected sexual contact. If you're going to have contact of any kind, you need to protect yourself and your partner from potential infection. And secondly, get vaccinated. And if you have children in the age-appropriate range, get your children vaccinated. There is as I said, there is a vaccine. It is approved from the age of 11 up to 45 now. It is approved for boys as well as girls, men as well as women, and it is a 2 or 3 part series depending on when you begin. Even if you already somehow know that you have HPV, you are still a candidate for the vaccine because it protects against 9 different strains. And if you likely have one strain, you will be protected against the additional strains. How do you know if you have HPV? The problem is that HPV does not give symptoms in most people, and there is not a reliable test to test men. They can be carriers and have absolutely no symptoms and no knowledge that they are infected, and can spread it to their future partners. For women, it is recommended that if you are 21 years old or older, that you have a pap smear, and talk to your doctor about whether HPV testing is appropriate during the pap smear, and that is the best way for early detection and monitoring. And this is regardless of your sexual preference or gender identity. If you have a cervix, you need to have testing done. So I hope this helps answer some questions you may have had, and I appreciate you tuning in, and we'll now open it up to some questions if any of the viewers have things they would like to know.
Question. What is the latest age you can get the vaccine?
Currently, they have raised the age up to 45. Initially, the vaccine was approved up until the age of 26, and the FDA has expanded the age range for vaccine candidates. Interestingly, you still can be vaccinated outside of the age range. You should discuss this with your doctor because it may not be considered a routine vaccination by your insurance, but there are people in their late 40s and 50s and even older who are starting a new relationship after a divorce, or entering the dating world, and would be candidates for the vaccine.
so is it, if you are in a monogamous relationship and you don't have HPV, should you still get the vaccine?
A good question. In theory, if you are in a monogamous relationship, meaning you only have sex with your partner and they only have sex with you, and neither of you has HPV, the imminent threat is very low. But unfortunately, as time goes by, if you split up and have a new partner, you may end up being a candidate for the vaccine.
Last question. Should boys and men be vaccinated?
Yes, good question. Originally, the vaccine was just approved for females from the age of 11 to 26. And several years ago, the FDA expanded the demographics to include boys and men. And it makes logical sense because most women acquire the virus from whom? From their partner, who a lot of times is a male. So the thinking is if you can prevent the male part of the equation from getting infected, you can then prevent subsequent contacts with that male from also getting infected. So it is approved for boys and girls, men and women, from 11 up into the 40s.
Thank you.
Thank you for watching, and hope you've learned something today.